Sarah. There we go. We got the recording going. Thank you so much. If you don't mind just going around the virtual table quickly, just so I get a sense in terms of who's here. And then I can kick this thing off. So I'm gonna popcorn this thing over to Carla to start.
Good morning, Tomas. Carla Berg, Arizona Department of Health Services, Chief Strategy Officer.
Thanks,
Over to Christian.
Hi, my name is Christian Baca. I am the Service Design Lead in the Innovation Studio for Maricopa County.
Oh, awesome. Thank you. Nice to meet you.
I'm Stephanie.
Hi, everybody. Stephanie Parra, Executive Director at All in Education. And I'm popcorning.
Stephanie, nice to meet you virtually.
Nice to meet you. Thanks for having me.
I see you all over social media.
Should I toss it to somebody?
Yes.
Let me see. Anna, looks like you're next on my list.
Sure. Hello, I'm Anna Bettis. I'm the Healthy Cities Program Manager for the Nature Conservancy. And I'm also driving. So if maybe someone else should just jump in after me. I don't see the name. Sorry.
No worries, Anna. Thanks. I'll hand it over to Taniqua.
Good morning, everyone. This is Taniqua Brown, the Executive Director for the state of Black Arizona. And I'm driving as well, so I can't see who to popcorn it to.
No worries.
I'll take it. That Windsor, chairperson of new nonprofit Gather and Grow.
Oh, awesome. Yeah. Nice to meet you.
Nice to meet you.
And then Aaron, you want to introduce yourself?
Yeah, this is Aaron Bear. I'm a co-founder of Arizona Foundation.
Great. Thanks, Aaron. Well, thank you all for joining me to learn a little bit more about the Blue Zones Activate South Phoenix initiative that we are just beginning. Well, not just beginning. We've been doing a lot of community building work leading up to where we're at today. But the work we're doing with Blue Zones in South Phoenix builds on a lot of the work that we've done through the One Community Initiative against COVID-19. Some of you may be familiar with that. We partner with the county and the city of Phoenix and the state of Arizona and a lot of public-private partners. We co-founded and created the One Community Initiative against COVID-19 together with Arizona Foundation. They've been our long-time partners. We've been at this for a couple of years. I asked Aaron to be here to introduce himself. And Aaron, I don't know if you want to talk a little bit more about the One Community Initiative and what we learned there and how we're building on that alliance and that work to focus on South Phoenix. So if you want to share a few words about that.
Sure, yeah. So as Tomas shared, we've been working in South Phoenix for Arizona Foundation now over 12 years. And when COVID came up, we ended up creating the largest testing site actually in the country at the time. And then partnered with Tomas and really became our health equity partner in the community. And so far, I think Tomas, the numbers, we've vaccinated 85,000 people. And is that the number?
just over 80,000.
Yeah. So we've had a pretty successful partnership and really excited about transitioning that work into a longer term health play, which, deals with mental health, deals with, the health of the community. And that's where this leads into this Blue Zone. So we're excited to take some of our work, kind of rebounding that into creating the healthiest environment we can for South Phoenix, which Pastor Stewart on Martin Luther King Day 2 years ago kind of challenged Arizona Foundation that 85040 led in 7 of the 8 negative health categories. So we really have a challenge to take Blue Zones into one of the areas that has a 14-year disparity in life expectancy than other parts of the valley. So the need for blue zones, as you'll learn from Tomas, is there, and honestly is going to be something we're going to need all the different community partners and everybody to be aware of what we're doing, and we're just excited to be part of it. And we see the long-term vision of blue zones, and excited to be on this call and just supporting you, Tomas. Thank you.
Thanks, Aaron. Yeah, I appreciate that. I think we all knew that when this pandemic hit, there was going to be a disproportionate impact in communities of color. Part of the One Community Initiative, not part of, the central goal of the One Community Initiative was to ensure fair and equitable access to testing, vaccination, medical support, as well as social support. And you know, as Aaron mentioned, to date, we have reached over 80,000 people with those comprehensive services, along with a lot of partners. So this pandemic response in diverse, underserved communities, you know, is not the work of any one person or any one organization. It's the work of all of us. And so that's what we've been doing, and we continue to do that to date. I'm gonna, in the chat, I'm gonna put in the link to the One Community Initiative. We're still doing testing, vaccinations, and mask distributions, N95 masks. We're doing in-home test kits. We're offering a lot of other social supports and connections. So I'm going to put that in there so you can see, learn a little bit more about that One Community Initiative and all the partners, public-private partners that are part of that, that we're engaging in the work of blue zones moving forward in South Phoenix. Why South Phoenix? Well, South Phoenix, we spent a lot of time in the last 2 years in South Phoenix with the One Community Initiative, focus on a lot of the zip codes that were had high exposure to the virus and high case counts, low vaccination rates. So we've been breaking down barriers, bringing all these services into the neighborhoods and the zip codes in South Phoenix and throughout Maricopa County and other parts of Arizona. But what we learned from that experience is that the zip codes and communities in South Phoenix were really hit hard by this pandemic. On top of the life expectancy gap that exists in South Phoenix compared to other communities, for example, in Scottsdale, North Scottsdale, there's a 14-year life expectancy disparity gap. Now you add on top of that 3 years of loss of life or longevity life for the Black and Hispanic community as a result of the pandemic. That's 17 years. So the pandemic didn't necessarily cause all of these issues. It just revealed what we already knew about the disparities and inequalities that existed in diverse, under-resourced communities. And so now we are putting a spotlight and focus on pandemic recovery and focusing on South Phoenix. Oftentimes South Phoenix gets overlooked for a lot of investment and support, and we wanted to make sure that we were continuing to be good partners there and bringing all the resources and partners that we can to support the residents in South Phoenix. So just a little bit about our foundation, the Equality Health Foundation, our vision, it's equal health for all. That's what drives and inspires us to get up every day. We believe in a society of healthy communities where every person, you and I, can achieve their highest potential for health. But we know that in order to do that, we know there's some communities and populations that have a lot of barriers to good health. And so we have to level the playing field in the diverse, underserved communities that we serve to remove those barriers and build healthy communities and support people to achieve their highest potential for health. So that's our mission that drives our work, and certainly we're inspired by the vision that we have. We focus on three community impact pillars or areas. The first one is reducing health disparities. The second is expanding access to care, to culturally competent whole person care. And the third is accelerating health education, not just health literacy, but increasing the pipeline of diverse healthcare professionals, whether you're community health worker, nurse practitioner, a nurse, physician, healthcare administrator, or healthcare innovator. We want to increase that diversity of that pipeline and make sure that we're building a culturally competent healthcare delivery system, including partners that address the social determinants of health. The role of our foundation is, we alone can't impact the social determinants of health in communities. The work that we're taking on is, like many of you and your organizations, taking on bold initiatives and visions, and it requires a lot of collaboration across public-private sectors and across the community to make sustainable transformation change. And we call it a movement for advancing health equity for all. So we're a convener, we're a collaborator, we're a community innovator. We identify social determinants of health challenges in communities, and we bring partners together to innovate and help address those conditions in community to create a better environment for people to achieve their highest potential for health. And so you may be familiar with the 80-20 ratio, where 20% of what impacts your health and my health is health insurance coverage and access to quality care inside the four walls. 80% or more of all of the social determinants of health that impact your health and my health: education, housing, employment, environmental, etc. And those are factors that have a big influence on our ability and the ability of communities across Arizona, and particularly in South Phoenix, to achieve their highest potential for health. So we're working together with a lot of partners to tackle those social factors and economic factors that influence health. So when we started focusing on pandemic recovery and looking at different models to implement and to facilitate the pandemic recovery and building resiliency and community preparedness and beginning to address the health and well-being of communities, we ended up selecting the Blue Zones model because we felt that that was an evidence-based, place-based model rooted in a lot of longevity research that we felt we could might be a great model to implement in South Phoenix. And so just want to share a little bit about Blue Zones. You may be familiar with Blue Zones, but it's undergirded by a lot of researchers. Dan Buettner was the founder, brought together geologists and anthropologists and longevity researchers and epi teams to study the long-lived cultures around the world. And they identified 6 of those long-lived cultures where people are living quality, long lives, and some of them reaching centennial age of 100+ years. And so he went to discover the fountain of youth and didn't find it, but what he found was these communities that people lived a long time and with quality of life, and found some commonalities among all of them, and extracted those commonalities, 9 commonalities, into what they call the power of 9. Basically, just in simplest terms, I won't go into each of these, but it's all about having the right outlook, what you eat, how you connect with your tribe and your loved ones, how you move naturally in your community, in your home, in your neighborhood, in your city, and making sure you have a sense of purpose in life. And all of this is supported by what we call the power of 9 characteristics. And so they fall in 3 domains, which is the life radius, and people, places, and policies. These are all the domains that impact a person's environment, and that will either support or be a barrier to achieving optimal health or good health and longevity of life, or adding more years to your life and making the healthy choice the easier choice. And so they call this the life radius model, because most people spend, the majority of their lives within 20 miles of where they live, where they work, where they play, where they pray. And so that's why a evidence-based, place-based model made sense, where we can apply and implement some of these best practices and next practices in communities where we can help support making the healthier choice the easy choice. And so again, this work is done in homes and schools and work sites, grocery stores, restaurants, faith-based organizations, in partnership with the local community, all focus on addressing people, places, and policies that can create permanent or semi-permanent changes in a community to support healthy living in a community. There's 3 phases to Blue Zones, and the community development process is another thing that we really appreciated and liked about the model. The first phase is the assessment and blueprint planning phase. This is the phase that we're in right now. So we're not proposing to come into South Phoenix and say, this is what we think you need, and this is what we're going to do. It's a meet me where I am approach. People support what they create. So we have to understand and learn what's happening in South Phoenix, what people are experiencing, what are the assets in a community, what are the challenges, what are the opportunities, and what are the priorities in these 9 zip codes that we're going to be focused on in South Phoenix are important to the residents there. And based on this community assessment, that'll inform priorities that determine what type of best practice strategies and interventions and programs are going to be implemented in the next phase, which is the activation phase. So we're going to be spending some time in the end of March, we call Power Week. Some of you may have received our invitation already to join us for the kickoff event, the keynote event on March 28th. I'll make sure you get that if you haven't received it. And then we have a week long of neighborhood presentations, neighborhood walks and tours, and one-on-one interviews and focus groups that we're doing with the local community leaders and residents, just to get a pulse on what's going on in South Phoenix, and what can we build on that's already the great work that's being done already, and what can we amplify that's effective, and what are new interventions or strategies that we might be able to implement in South Phoenix. The next phase is the activation phase, where we start aligning priorities and implementing key policies and strategies, building local community capacity to attract additional resources and raise the community profile, and start adopting and implementing some of these interventions and strategies for Blue Zones in South Phoenix. And then the third phase is the transformation phase, where we're expanding on interventions that are working, adapting what's not, proving impact and showing results, and then leveraging the value of all that work in South Phoenix and telling the story of South Phoenix to create more momentum and attract more resources and support for South Phoenix. So this is a 5 to 10 year time horizon. This is a long-term sustainable strategy and approach that we're taking. It's not a one and done and 1 year. I mean, this is community building work. This is sustainability work. This takes all of us working together in a community like South Phoenix to support what the community wants and the future that they want for themselves in South Phoenix. The other thing that I liked about the Blue Zones model was that it's evidence-based, there's measurable results, there's evaluation measures that we're going to be focused on and using to benchmark progress over year. Blue Zones has been implemented in about 60 plus cities across the country, each of them implementing the model, adapting it to their local community, measuring different metrics that's important to them. For example, small community Leah, Minnesota, they've been at this for 10 years. They've been able to see a 49% decrease in medical claims, 2.9 years added to lifespan there, 48% increase in tourism, and jumped to 34th place in Minnesota County health ranking. So they've seen some pretty significant impact there. And there's been about $40 million of follow-on grants to support Blue Zone programs and projects there. Similar impact in Beach Cities, California. They're in year 7. They've had a drop in childhood obesity and increase in exercise activity, drop in smoking, 12% rise in life evaluation, and then it's 72 million medical costs and lost productivity savings there. So there's both community impact and health impact. There's productivity in terms of business and economic impact. They've been able to increase their life evaluation, by 12%. Fort Worth, Texas is another great story there. They've seen their mayor there has become the champion and taken on Blue Zones. As our mayor, Kate Gallego, has signed on to be a community champion and champion Blue Zones in the city of Phoenix. So we appreciate her jumping on and using her platform to promote Blue Zones. And they've seen a 20 billion lifetime reduction in smoking value there. So there's always a value to any of these metrics that are measured just in terms of not just community impact and health and wellness, but economic impact and productivity impact. Another example in a healthcare system is a larger employer. I've seen a $27 million medical claims reduction there. So the community, the measurable community impact in terms of improving well-being, it improved outcomes in several domains. Some of the domains are health outcomes in terms of healthcare cost utilization, hospital readmissions, hospital admissions, and the disease burden. And as you know, diverse communities, and particularly the Black and Hispanic community, experience a great burden, disease burden, tied to a lot of disparities in care and health and access to the support and resources they need to achieve optimal health or manage their conditions. There's a business outcome measure and impact in terms of performance and unplanned absence and turnover and safety and productivity, as well as community outcomes and with crime rates, high school graduation rates, teen pregnancy, motor vehicle deaths, et cetera. And then the mental health outcome, as you know, the pandemic has exacerbated, the impact of mental health and challenges in the younger population, senior, and across all populations for that matter, in terms of anxiety and depression. And so this is going to be a key important metric that we'd like to engage and encourage the community to measure. So when we decided we were going to move forward and consider implementing Blue Zones, we held several community meetings, executive overview meetings. And since last September, I did a lot of one-on-one meetings with different community stakeholders. And one of the things that was a takeaway for me and that they was a big concern and was a recommendation was, look, Tomas, Blue Zones is proven to be an excellent model, and it's being implemented across cities and counties across the United States and in other countries. But we want to make sure that Blue Zones and this work is aligned with existing recovery, preparedness, and health improvement plans, so that there's state and local collaboration happening, that it's just not another thing, another fad and nice thing to do in a community, but that we're really tying it to a lot of the work that's been done and being done. For example, the Arizona Health Improvement Plan and Arizona Pandemic Recovery and Resiliency Plan. Carla Berg is here, your fellow your fellow, and with the Arizona Department of Health Services. Carla serves on the steering committee for this Blue Zone initiative, so we're grateful for her guidance and helping us align this Blue Zone initiative with these plans with Arizona Department of Health Services. And then we've been talking with Mayor Gallego and Vice Mayor Garcia and other community leaders about aligning Blue Zones with the City of Phoenix plans. There's a lot of work that's been done. There's a transit plan that's gotten revived and supported. We need to make sure that what we do with Blue Zone is aligned and tied in supporting the goals and the objectives of those plans. Same thing with Valley of the Sun United Way, Mighty Change strategic plan. Valley of the Sun United Way became one of the founding sponsors for this Blue Zone initiative, and they see great alignment with their Mighty Change plan and want to support this initiative and partnership long term, particularly around food insecurity and housing and employment. And then there's the Greater Phoenix Economic Council Vision 2030 plan by GPEC, and there's great alignment there because there is more and more of a focus with these economic development plans and business plans that focus on the whole community. That we need to create a culture and a community that supports health and well-being for individuals and communities, because that leads to productive and healthy employees, which supports productive businesses and contributes to more of an economic vitality in a community. And then you have the Health Improvement Partnership of Maricopa County and the recent health equity work that's being done there that has great alignment with the Blue Zones initiative. And then we're working with the Arizona Town Hall and the Gallup Arizona through the Center for the Future of Arizona to make sure that we're utilizing all the data and information and input to contribute to the work of the Blue Zones process as we move forward. And then on the right side, you see Blue Zones assessment, which is what we're doing now. We're in that community assessment phase where we're having a lot of conversations with one-on-one meetings, focus groups, overview meetings, presentations. We're looking at local available data. We don't want to survey and over survey, because South Phoenix, that's happened a lot. And it happens a lot. It happened in my community. I grew up from humble beginnings and in the West Side in Tucson, Arizona. And I've worked in a lot of underserved communities that get surveyed a lot, they get used a lot, and then resources are acquired by whatever institution and organization comes in a community and say, hey, we want to help improve your community. And then the grant ends or funding ends, and then they're gone, and there's nothing sustainable. There's nothing lasting in that community. So we're very mindful about the approach that we're taking in working in South Phoenix. And that's why we're reaching out to you all. We're reaching out to a lot of our partners through the One Community with Arizona Foundation and others to guide us and engage community leaders and residents in this process, so that that's what informs the outcome of the assessment, the priorities, and that what directs and informs what we do next together with the community. The other key learning that we took away, and I'm part of the board of directors for the Arizona Hispanic Chamber of Commerce, and we've adopted the elements of healthy community by the Vidas Foundation because we think it ties directly to business development and success, economic success. I like their cross-cutting lens of this framework, which the Arizona Town Hall used recently: equity, social justice, and resiliency. And again, this statement that I took from their document really resonates with us in terms of our vision and our mission, and in terms of how we define health equity. It's achieved when everyone, regardless of your race, your neighborhood, sexual orientation, financial status, has the opportunity for good health, mental, physical, economic, and social well-being. And so that aligns with our approach at the foundation, and that aligns with with the Blue Zones model. And I just wanted to highlight the community engagement plan. Let's see here. Great, thank you for those who are posting information and resources in the chat room. Right now, I'm in search of any plan, any report, any data, including others we should engage to participate in this process as well. So thank you for pointing that out, Anna. I appreciate it. So we've been at this since September 15th, where we started reaching out to potential sponsors and collaborators. During that time, the Conference of Mayors passed a resolution supporting Blue Zone community well-being initiatives across the country. So they challenged our mayor here, and we asked our mayor, will you sign on to be a community champion and use your platform to promote Blue Zones starting in South Phoenix? And she said, absolutely, I'm on board. Next in the process, community engagement process is what we call Power Week in the community. So the analysts and experts and researchers from Blue Zones, including Dan Buettner, who's the founder of Blue Zones, will be in community March 28th through the April 1st, where we'll be doing a kickoff keynote event on the 28th, neighborhood presentations, one-on-one interviews, focus groups, and a policy discussion during that week. So we're really going to be rolling up our sleeves and learning from community leaders and local residents during that week. As you know, any initiative requires funding. So we've been busy. I've been busy submitting a lot of proposals for founding sponsors, and we've been very fortunate to get support from the Arizona Department of Health Services, Valley of the Sun, United Way, United Healthcare, Arizona Public Health, Arizona Public Services, APS, the Flinn Foundation, Vitalis Health Foundation, Virginia G. Piper Charitable Trust, Center for the Future of Arizona, ASU College of Health Solutions, DRASA Development Fund, including the Arizona Governor's Office with support with American Rescue Plan funds. So it's been a overwhelming support for South Phoenix and for implementing a bold well-being transformation initiative there using the Blue Zone model. So I'm gonna stop there. I know I threw a lot at you, and you probably have some questions, and I welcome your questions or feedback or guidance. Again, just grateful that you joined me here this morning. Grateful to the Flynn and Brown Academy for giving me this opportunity to have you as an audience here. So, any thoughts, questions, guidance?
Hey, Tomas, it's Camila.
Words of wisdom, encouragement.
Definitely encouragement. And so I'm happy that you expressed what many of us living in South Phoenix express in the way of we get to be guinea pigs, right? We are in most need. So it makes sense that you start with the community that is in most need, and the community that is in most need will show improvement fairly quickly. And then it becomes that pilot project that says, see, it works. We were there for 2 years, but the funding runs out, as you indicated, and there's no sustainability, and there's no handoff to anyone in the community to keep it going. So even when we learn how to do the thing, there's no data, there's no support to train the trainers, so to speak, so that we can continue this in our community without everyone else coming in and saying, we can tell you how you should live your life. As the community continues to change, I have no doubt GPEC is interested in making this a more viable community. It's always only made sense, but now it's economically advantaged to do so. And I know that sounds like cynicism and sarcasm, and I don't mean it to sound that way. I'm happy about it because that means there is an interest in investing and having us move forward. So I shared in the chat the work I'm transitioning off First Things First, which is the Arizona Early Education Board. I am part of the Phoenix South region, and we have for years collected data on family members in South Phoenix. So with many organizations, when they choose South Phoenix, it's always different in terms of how you define which zip codes are in and which zip codes are out. But I would strongly recommend using the data center that has now been created by FTF and matching that up with your zip codes to get the data that already exists. And what's happening with FTF now is finally, after 10 years, a partnership with Access. Because one of the things we know is that for our area, 75% or more of our babies are born on the Access program. So data that you can collect from Access, though they don't collect it by zip code, is available to help understand what families are up against. The other thing I would share is I was with you during the Arizona Town Hall program.
Oh yeah.
So
awesome.
I would also share that it would be great to stay connected with them and to have the contacts from the Arizona Town Hall that were there that are also in social services beyond just South Phoenix, where their work intersects and networks with folk to be able to make this a sustainable program and process the learnings so that we can continue when, you know, people leave. And you say 14 years, it's something to say that my choice to live in South Phoenix means I have chosen to live a shorter life expectancy. And so I think we should clarify when we say 14 years, what does that really mean? Stress, right? Living in stress. And sometimes you can't avoid being in stressful situations. The people that live, that qualify for Access, but still live and make it every day, that's a stressful situation to be in, but they still do it. So where you say that ASU is providing in-kind services, I strongly believe, and I think your partner, United Healthcare, believes that mindfulness work works. So one of the things that I would strongly suggest is making that resource available sooner rather than later so that people can you know, improve their situation themselves.
Yeah.
While you get all the research and everything done.
Thank you for that. Yeah, I'm very familiar with First Things First. I was part of supporting that earlier on those efforts when I was running the Tucson Hispanic Chamber of Commerce. So I did a lot of policy advocacy with the Bashas and others. So, and then worked to support those efforts when I was in Tucson. And I've seen some fact sheets and some information from First Things First on South Phoenix. So thank you for that. We don't want to recreate the wheel here. We want to take any and all available data that exists to inform this community assessment process. I'm mindful of what happens in a community, my own community, and what's happening the only public housing community area in Tucson when I was working there on a project of gentrification that happens, right? So you improve a community, but you don't improve the health and well-being and economic status of individuals in that community, and then they no longer can afford to be there, live there. And so while we change a community, we have to lift up community residents so that they can be successful in that area. So, yeah, I grew up in a trauma environment, right? In the barrio, in the hood, you know, where it impacted my health and my well-being and that of my family and other, you know, families in the community. So, you know, growing up in a trauma environment, you know, does add to, you know, anxiety and depression and other kinds of challenges that affect your quality of life and longevity of life. So,
and it's not all negative, right? Like you can grow up in that environment, but you get stronger, right? You become resilient. You learn
resiliency.
You can learn and be happy, right? There are people that have a lot of stuff and they're unhappy. So it's not all negative. I would also
exactly right.
say,
well, I want to point out that the long-lived cultures, the original long-lived cultures, most of them were at the poverty line or below, to your point.
Right. And I think that's what.
Yet they're
you know, I
living
heard about-
quality of life and long lives. You know, your point is well taken. Yeah.
I think Blue Zones, the first time I heard about it was in the Happiness Advantage. And in that book, they
Right.
talked about longevity, and it wasn't about all the stuff that people had. In fact, it was the,
Right.
you know, as you said, they didn't have stuff, but they had acceptance and they had a standard that everybody met. They didn't leave people behind. And
Yeah.
they worked and they moved and they ate, you know, they didn't eat processed stuff all the time.
That's right.
So there's work to be
Yeah.
done. I would also say that LIS is working in this area too, in South Phoenix specifically. And they've hired consultants as well to do some assessment work and to do some community conversations. So one of our Flinn-Brown Fellows, David Longoria, is working on that space. So I think the two of you might know each other. And so if you connect,
Yeah.
that might be an advantage as well.
That would be great. And I've met and had conversations with Terry as well at LISC.
Okay.
Yeah, so I want to continue those conversations and figure out how we can work together and support one another. You know, again, I want to make sure that we're connecting with the right people and supporting existing work that's already going on. By no means we're coming into the community and saying, hey, we know it all, we're the experts, this is what we're going to do, and this is what the people need. I learned long ago from my mentor in community development, Bill Lofquist, one key principle that I've lived by and I use in all my community work that I do, and that's people support what they create. So you have to co-create and bring people to the table and be part of that learning and that co-creating and partnering together. And that's what I live by personally, and that's the approach that we're going to take with this initiative in South Phoenix. So thank you for your feedback. Yeah,
I'm not done. I'm a Flinn-Brown
Oh,
Fellow, so
great.
I'm never done,
Hey.
right? So
Hey.
I would also say Taniqua and her group, right? They have done research and they pulled some research out. So I would say, you know, go to their website and get there, because they've done work in education, particularly during the pandemic, and conversations around what some of the challenges were in terms of the access to, you know, computers and the ability to access that way. And as healthcare moves to accessing from computers as well,
Yeah.
I think we leave our seniors behind because they're not interested in using computers. And
That's right.
if fundamentally your well care and your checkups come through computer systems, if you're not providing somebody to help them or providing the system and paying for that so that they can access, you've created a different accessibility issue, right?
Yeah.
And then can you speak
Yeah,
to
there's
how
that
FQHCs are-
digital divide that happens, right? So
right,
as much as technology helps enable help, it's not accessible to everyone, and it's not for everyone either. So
right, because we've got generational divide, right? They're like, I'm good with the TV, right? I don't need all this stuff.
Yeah.
So
That's
can
my
you speak to how
mother-in-law.
FQHCs, they have a similar mission. So how are they part of this work?
Well, FQHC has been a key and instrumental partner with the One Community Initiative. So we partnered with Adelante Healthcare, Valle del Sol, Wesley Healthcare Center, and some others as our testing and vaccination partners. So we're engaging them in this process too, because part of what's important is access to quality, culturally competent care in South Phoenix. So we want to make sure that we understand the access barriers there, and to support enhancing and expanding access to quality, culturally competent care in South Phoenix. And so part of the assessment is to do that asset mapping, what's available, and where is it available, where are the gaps, and what capacity do we need to build and support among these FQHCs to make sure that all of South Phoenix is covered, and that people do have access to high quality, culturally competent care.
So you'll be using Access and their network and availability information for the area to help do that.
Yeah,
Okay.
we partnered with Access. Director Schneider at Access was part of a presentation we did to the managed care organization, the health plans, Medicaid plans, a couple of weeks ago. We did a similar presentation and sharing what we're doing and aligning the health plans to support our work there. Also, we're doing a similar presentation to a network of healthcare providers that have a footprint and service in South Phoenix as well. Many of those include FQHC. So we have a presentation coming up in a couple of weeks with that group of healthcare providers. So, and a lot of the FQHCs that I mentioned and some others are involved in that provider group.
Okay, I just mean from the data perspective to understand what sits where and where there is a gap that also exists through Access.
Absolutely, yeah, and we've been having conversations with them about that utilizing that data as we have with the Arizona Department of Health Services as well.
Cool.
I know we're running at time, so I just want to be just share a couple of thoughts here. Really appreciate the work that and effort that's going into this, and super supportive of it. A couple of things I looked on your website and I noticed that the school district that I serve on, Phoenix Union High School District, is not listed as a partner right now. So I'd love to support you in making sure that Phoenix Union collaborates. Roosevelt District is one of obviously our partner district in South Phoenix, but they only serve K-8 families. And so we serve 9-12. And so making sure that high school students and their families are part of this effort. And then similarly, how you have the Arizona Department of Health Services when it comes to data, the Department of Education, Superintendent Hoffman and her office will be phenomenal partners. They have been for my organization in data sharing. And so I would definitely, from a state level, have that the Department of Education also be a partner on this. And just I dropped a couple of things in the chat. We have our MAPA report that we publish on an annual basis. It's the state of Latino education, power, and influence. And we have concentrated in South Phoenix and elevating the data there because it is where our a high concentration of low performing schools are. And what you see is that they are, our schools are often segregated, not just here in Phoenix, but across the country based off of race and socioeconomic status. And so lower performing schools get access to less resources. As a result, the academic achievement of students suffers on the back end. And so we are taking a more comprehensive, holistic approach to education advocacy at All in Ed and are lifting up, borrowing from the health sector, lifting up the social determinants of education.
Yeah, I saw that.
And so, yeah, we'd love to, I'd
call
love
it
to collaborate.
education determinants of health or something like that.
Yeah. So similarly
cool.
to what health sector has done, we're lifting up some key, actually doing a recording on poverty and education tomorrow with the superintendents of both Roosevelt and Phoenix Union. And so that'll come out in the next week or so, but want to lift these things up. And so we'd love to find ways to be supportive of your effort and collaborate. Similarly, I think the approach that the health sector has taken on a more holistic approach to achieving health, we want to take that holistic approach to achieving education excellence. And so, all that to
That's
say,
excellent.
Excited about what you're doing, want to be supportive and be a thought partner on however we can be.
Yeah, that's fantastic. Thanks for that direction and feedback. Love to connect with you on Phoenix Union.
Yeah,
making
absolutely.
sure that we've supported a lot of COVID testing and vaccination events in many of the schools there. Want to most definitely have a stronger connection with the work in South Phoenix. I love the way this holistic approach is evolving with our work in Arizona and with your work and conversations we've been having, as well as with the Arizona Town Hall recent conversations, because health is education. Health is employment, health is housing, health is tied to everything. And so, that cross-sector collaboration has to happen in order for us to have a more holistic impact in a community or in people's lives. So thanks, Stephanie. Yeah, I'm going to follow up with you on that introduction or bridging that conversation. So any others, any other thoughts, resources, guidance, wisdom?
I'll jump in and hi, I'm on my desk now, so I have my camera on. I was curious if you're thinking at all about heat and kind of the environmental aspect. I dropped a few links in the chat, and I might add a few more. In our work, when we've kind of mapped out the issue of urban heat across the valley, we see that the hottest places also have the highest child poverty. Also have the lowest tree canopy cover. There's research that shows there's places as little as 2 miles apart in Phoenix that have up to a 13-degree difference in air temperature. So when we've done some work with partners and heard from residents in some of these really hot communities, they've talked about, there's lack of even sidewalks and basic things, but also just it's very hot, and being able to go out and be active. Not everybody, has equal access to be able to do that. So happy to share any of our maps or any resources that I can, if that's part of the way you're thinking about this, but just wanted to chime in and share that.
Thanks, Anna. It is part of it. It's the power of 9 commonalities. One of that is how people move, right? So you like a built environment to allow people to move naturally. And we haven't quite designed our communities that way. If it's too hot and the community is not designed where it supports natural movement and activities and safety, particularly for young kids, whether they're bike routes and parks and gardens and other kinds of things, that's going to impact their mobility, right? The next issue, other than smoking, was a sedentary lifestyle, right? So that's the new smoking. We're kind of, our kids are glued and stuck to technology and things of that nature, and not getting out and moving. I would love to take a look at that. I want to make sure also that I follow up with some opportunities for you to participate and help us and provide your expertise and guidance. There's some focus groups that we're going to be having during Power Week. It would be great to have some of you as part of those. There's also some one-on-one interviews that we'd like the Blue Zones analysts and experts to have conversations with you. And then I want to forward all of the resources you're sharing with me to the evaluation team, the assessment team, so they can start combing through that and developing a more comprehensive picture of the 9 zip codes in South Phoenix. And then, of course, I want to extend a personal invitation to join us on March 28th for the keynote at the end of March. So that'd be fantastic. You would be willing to join us for that. Any other thoughts or recommendations or resources? Words of wisdom? All right. Well, I'm going to put my, I think you may have it already, but I'm going to put my cell phone number in the chat. If you have any other thoughts, want to get involved or have a recommendation for others to get involved or ideas, feel free to call me. I'll reply all to you on the email invite for this meeting. I'm going to share the maps with you for South Phoenix. That way you have the zip codes, and then some other results document so you can see some of the outcomes and impacts from some of the other projects across the country. I think that would be interesting just to kind of take a look at how other communities are measuring impact, and then I'll list other opportunities in that email for you to participate. But thank you so much for your time. Thanks for your questions, your resources, your feedback, your guidance. We look forward to being a support for the residents in South Phoenix. Hopefully we'll see you on March 28th at the keynote event, and look forward to engaging with you long-term on this project. Stephanie, we've been talking with Paul Luna too from Helios Foundation. He serves on our board, about the education piece here, right? We want to make sure there's a pipeline of education opportunities for young people in South Phoenix to, not only graduate, but go on and land career opportunities, and to whatever extent we can influence them to get into that healthcare pipeline. We need more diversity in that healthcare pipeline as well. So, but thank you again.
Absolutely. Thank you. This is great. I'm excited to continue the conversation and support however we can.
Great, awesome. And let me see here. I am making sure I got everybody's contact. So Sarah, thank you so much. Please extend my gratitude to Tammy for giving me the opportunity to convene with the fellows. Please reach out if you have any other questions or any guidance. So thank you.
Yeah, thank you so much, Tomas. Thank you, everybody. Have a great day.
Great, my pleasure.
Thank you.